The only data we have right now is Schonenberg. It's a retrospective single institution study that looked at sequencing of immunotherapy and EGFR tyrosine kinase inhibitors. He found that the risk of adverse events, the risk of immune-related adverse events, is higher if osimertinib is used within 3 months after immunotherapy, and it decreases if it's used 3 to 12 months, and it's non-existent if you started tyrosine kinase inhibitors 12 months after you completed immunotherapy. It is interesting that in that data he did not seem to show the same pattern for either gefitinib or erlotinib, which is contrary to the Lisberg data that we just discussed in a previous talk, showing at least one case of fatal pneumonitis after pembrolizumab. I think what it made me to do, what we've discussed for the patients who I have to start therapy right away, where I don't have time to wait for the molecular testing, I tend not to give them immunotherapy. I tend to give them chemotherapy, wait for the molecular testing to come back, and if the molecular testing is negative, then add immunotherapy to those patients, maybe to a third or fourth cycle.